Are you cut out to be a nurse? Well, I have one area of nursing specialty that I feel like helps determine if you are cut out for nursing, and also helps with time management and really lays the foundation for the type of nurse that you'll be. Hi, I'm Shawnee, and welcome to the Nurse Executive Files. This is just for you, whether you're a new nurse, a seasoned nurse, or thinking about becoming a nurse. I have tips and tricks and secrets that very few nurses will tell you about. This area of specialty is near and dear to my heart, and you don't even have to have a license for this area of nursing. This area of nursing, I feel like, is not really praised, and I feel like it should be. I feel like this area helps you to connect better with other healthcare leaders on the team. I feel like it determines the type of nurse that you'll be. Okay, so it is a certified nurse aide, a CNA. And I was a nurse aide for about 9 years. I know some people are like, woo, you were a nurse aide for a long time, but listen, that is a certain type of specialty that truly I feel that no one really wants to do it unless it's their family members and they feel like they have to do it. But I think starting there helps determine and makes the best type of nurses. I really truly feel that CNAs make the best type of nurses. I don't mean have taken a nursing course or have gone through a clinical rotation. Or for a prerequisite for nursing, because you have to become a certified nurse aide as a prerequisite. I don't mean that. I'm talking about working in a long-term care facility. And when you're working in that long-term care facility, you're taking care of residents that are there. They're not considered as patients. Patients are people that you see in a hospital. When you're dealing with a long-term care or assisted living, that's where they live. That is their residence. So they're considered as residents, just like you are a resident of your home. You're not a patient of your home. You're a resident of your home. So listen, I can tell you, I can talk, like I said, around 9 to 10 years in that area. I was in nursing school at the time, raising a small family, married, and so trying to get through there. I did travel nursing as a nurse aide, PRN, because it was very flexible for my schedule. So if I needed a hot $100 at the time, several years ago, this was like let's see, I've been a registered nurse for about 16 years now, I want to say, and this is 2026 as I'm talking in this video. So back then, if I needed a hot $100, I could go do a shift, a third shift, and be back in class on a Monday and have money in my pocket. At the time. But listen, let me tell you something. Becoming a certified nurse aide really helps with time management in nursing. So by the time you get to be a registered nurse, you're not like overwhelmed, like, oh my God, I have 5 patients today. And I get it, based on medical complexity and whatever unit that you work on, it looks different for everybody. But for the most part, let's just say 5 patients at a hospital. For some people, they have a really tough time with that, and they're like, I'm leaving nursing altogether, and this is just a lot of work. And with those 5 patients, before there was even COVID-19, we had patients that were in negative air pressure rooms or isolation, where you have to dress down from head to toe. Labs, you got one having, surgery, drains, tubes, IVs everywhere. And I'm not saying that is the safest thing in healthcare, to have 5 patients with a high medical acuity. That means they have a lot of stuff going on. So I'm not saying that. But what I will say is becoming a certified nurse aide first, excuse me, for at least a year. And usually a lot of nursing homes, they have programs for high school students, and even if you're not a high school student, they have programs for anybody that wants to become certified. So you'll work there for a few months before you can get certified, and they will get you certified as a nurse aide. So all you would have to do is call a nursing home and ask to speak to their administration department, and to inquire about their CNA program. So they usually have CNA programs, and they're usually really good if they have a CNA program. But as a nurse aide, you will have sometime up to 10, not maybe 9 to 12 residents. That's a lot. And what makes it a lot as a certified nurse aide is that you are total care for them. So some of these residents are in wheelchairs, some of them got one leg, some of them, hearing is gone, everything, anything can take a, think about when you get up in the morning time, all the things that you do, just the time it takes to do hair or makeup, or if you have children, and the things that you have to do even before you start your day, before you get to work. Well, you'll have, like, again, 10 to 12 residents. They'll have to be up, dressed, and ready for breakfast. They'll have activities with activities coordinator. They'll have physical therapy. They'll have all the specialists come in. You're right there to help do all the transporting. Now, in my day, we had the crank up beds. We had a lot of crank up beds. We had some that you could push a button, but depending on where you work, because I did, like I said, travel nursing agency with CNA. Some of them didn't always have the fancy beds with the button. It was a lot. No lift where you can just put a button and help lift them up and transfer. You did everything with a gate belt or with a lift, or if you had another nurse aide that could help you to transfer them. Then they're, waiting for lunchtime. So then they can't just sit in a wet brief all day. Some people call it a pamper, but it's a brief is the proper name for it. Can't sit in there wet. And then some of them, they're able to walk a little bit, so you help assist them. So think about this. You can't be late on that, because if they're late on that, they're not going to get a chance to, I'm not saying they're not going to be able to eat, but everything is delayed. You do everything for them. You clean their rooms. Some places you do mop the floors in some places, but we'll get into that into another video. You would have, well, anyway, well, yeah, that's a whole nother conversation, because you have some hospitals to where, anyway, and that does impact care and safety. Yes, I know. But you'll take out their trash, you'll make their bed, you will do everything if it's for you, times 9 or times, do that 10 times. And so, that's when their integrity comes into play, their dignity comes into play, because you wouldn't want someone having you or your family member that you love, in bed all day, not feeding them or half groomed. You'll sometimes do baths on night shift to help with day shift. But if they say, hey, they'll tell you, I don't want a bath. Sometimes they're in a mood, maybe they're not talking, but they don't want to be bothered. And we have to respect that. So then sometimes we have to move, if you're not able to negotiate that, you have to move that bath or that shower to day shift. So you're literally doing everything. But it really makes you a strong future nurse. It really does. You learn time management. You work hard. You're in it, blood, sweat, and tears, not just yours, because we all have our outside family, but your blood, sweat, and tears, for them. I always say that nursing is not a glamorous thing. It's not a cute thing. It's all about unconditional love. And you have to remember your calling and your why that brought you to nursing, to say, hey, regardless, I'm here to serve and to do a job here. Somebody has to do it. And no one wants to do custodial care, which is long-term care. Nobody really wants to do it unless they really have to. So this really helps train your brain. It forms your mind to say, wow, I'm signing up for this. And even in, when you have 9 to 10, residents, and then other staff members have their own set of residents trying to get help. Hey, can you help me lift someone in the bed? It's hard to try to find someone like, oh my gosh, I'm going to do this today. You help people when you can. And so it really helps strengthen you, gives you a thick skin. Sometimes people try to talk down to you because they feel like, oh, I'm the nurse, or I'm the doctor, or I'm this, or I'm that. We'll talk about specialties in another video. But it really strengthens you. And, you'll also see where this healthcare system is broken with processes, workflows. You'll see a lot as a nurse aide as you pay attention, and that begins to help shape the type of nurse that you want to be. You may have in your head, I want to be a neonatal nurse practitioner. Sounds cute, like, oh, I really love babies, but then by the time you get to rotation, or after your nurse aide experience, you begin to see a whole new world. Like, man, I wish we could do this, or how can I help? I wish we could do it this way. And sometimes even report it to the manager or your supervisor, and it really rolls off their back. And that's why I got my specialty, my concentrations in leadership, because you have a different type of voice in that area. But anyway, So it really does determine the type of nurse aide that the type of nurse that you'll be. You can definitely tell those that have had CNA experience. Um, I remember being in a long-term care facility, nursing home, and a resident, they weren't about to fall out of bed, but they were close. I needed help pulling them up. So I asked the LPN that was, and this is not all LPNs, and all nurses are not like this, but you can tell those that really had that experience or not, usually. And she had her pill cup, and I said, "Can you please help me pull this resident up in bed?" She looks at me and says, "No, I have to pass meds." She didn't say no. I have to pass meds. So I looked at her like, that's safety is number one. Like, you should stop what you're doing. Don't make me find somebody else, a nurse aide who's probably tied up, when you're right there and you can help me. Or they talk to you any kind of way. I remember one time I was tied up, but I heard a call light. I needed some help apparently, and I said, room 101, needs some help taking them to the restroom. It was again two, LPNs sitting behind a desk, talking, laughing, and when I looked like, hey, I need some help, they looked like she was like, you go do it. You don't talk to people that way and say, you go do it, like shoo me away like I'm a fly. And anyway, so the thing of it is, it really helps you. So when you actually do become a nurse, because this has helped strengthen your relationships, how you communicate to people, how you see other people talk down to people. Nobody's anybody's maid or servant in this business, whether it's a resident talking to you that way or whether it is someone with a certain title or specialty or a license. And so when you get to that hospital, you can definitely see who's really had that nurse aide experience, because they're willing to do, I feel like it, they're willing to help more. It's a different type of help. And if you're in the hospital, you're a seasoned nurse, you know exactly what I'm talking about, with, asking, because even with me, when I worked in the hospital, and I will come in there and I'm ready to take off my jacket. I'm ready to roll up my sleeves, say, hey, how can I help you? How can I help you help them? Because if I'm helping them, we're going to reduce, the risk of them falling. We're going to, keep them happy and engagement. I do what I can. And I can't do that all the time, but if someone needs me right then and there, the thing is, help them. So that's my thing. And when you get assigned 5 patients in a hospital, it's not going to frighten you, because you've been successful already taking care of 9 to 12 residents already at one time. So it's a lot. The acuity is different when they're at the hospital. I get that. They'll have tubes that drains and all this, and you're like, man, I have five patients today like this. Like, this is wrong. This can't be safe. So the care can be done, but it's not always the safest if you have a very high acuity. And then that goes all the way back to the management team, to how they assign, but that's another story for another day. My main thing that I want you to know is that if you're thinking about becoming a nurse, have pride in a CNA, because even some people, they may not want to become a nurse. They want to do CNA, and that's okay. But I just want you to know that that is a stepping stone to becoming a nurse, a registered nurse, or LPN, doesn't matter, just a nurse, a licensed nurse. It matters. And so anytime I, used to work with nurse aides, I would, respect them, because it is hard work. It's very hard work. My hat's off to certified nursing assistants, or medical tech, patient care tech, all the names for a nurse's assistant or a nurse aide. But it really does help shape the type of nurse that you'll be. Because some people are like, oh my God, today was the worst day. I had somebody to pee on me, they threw up on me. Then you're dealing with blood, you're dealing with bowel fluids, you're dealing with so much stuff. But, I'll tell you something else too that's important. When you're at the resident, you'll have residents that will expire. And that's the proper name in nursing for that. You're not always going to have a team to help you. You have to prepare them for the family to come in. So you may be in there by yourself. I think I've had, in my not close to 9 to 10 years, one nurse to ask me, Do you need anything? Can I help you um, with this resident? Because they're no longer with us. They're no longer with us. But in that close to 9 year span, only I think one nurse asked me, can I help you? Do you need anything? Maybe two. Let's say if I'm lying, three. But three, and that's a stretch. So you're responsible um, to respect them at all times, even when they take their last breath. And you may be in there. Or I've had them to say, they've called me in there, you know, hey, your resident just expired. Can you go ahead and get them cleaned up because their family's on the way? While they go to their desk and do documentation that they probably haven't done in a long time. They're trying to fill in the gaps. And I'm like, man, this is really? So they did it like they took care of them like there was a checkbox, you know, on a to-do list. So it really does help strengthen you becoming a certified nurse aide. And it helps you to, I feel like it determines how long you'll stay in the career. It'll help to strengthen your why as a nurse. Why did I become a nurse in the first place? Why do I love nursing? You know, so yeah, that's just something to think about. But definitely in the comments, let me know your thoughts about the type of area, the specialty that determines, you know, a strong nurse. What are some qualities that you feel like determines a strong nurse, or whether they will, you know, are they cut out for nursing? What are some qualities that you feel are important? So I will leave you with that. And until next time, we'll talk soon.